This is the ASMR Medic, and today I'm going to be covering some anatomy revision. I'm in my first year of medical school in London, and I've always found revision, especially anatomy revision, which is pretty much just pictures. I found it easier to draw them find it easier to remember things by drawing them. I find it sticks in the memory a lot easier. So I'll show you the sort of things that I have done and sort of what you can expect through this video. Today we're going to be covering the knee, part of the lower limb, as I'm sure you all know. This is the sort of thing that I try to do. I like to take quite a bit of care over the pictures that I make. So these are the bones of the lower limb, which is anything from the top of the thigh down to the very bottom of your toes. So I draw them, I colour them in. I try to make it as quick as possible. I don't want to dwell too much and waste too much time. There's a lot of stuff that I need to cover. But I do like to take a reasonable amount of time. And then I annotate them, and as you can see I add small annotations to certain parts of the drawings that I make. And then I can refer back to these, I can copy and paste these. So for example, I took a bit of time to draw the entire lower limb from the pelvis. This is the pelvis. I'll just circle it for you. This is the pelvis. I'll use a different colour actually. I'll use a big one. This is the pelvis, I'm sure you know. And then you have your femur bone, the largest bone in the body, the strongest bone in the body. Very hard to break that bone. Followed by the bones of the leg. This is the region we call the leg. It's a misconception that the entire thing's called the leg. The top part, the upper leg, as you might want to call it, this bit, is it's called the thigh. And then so this file is just bones, and I can copy and paste these images, and then I do the NV, stands for nerves and vessels. So I just copied and pasted the exact same image, you can see it underneath, same drawing. And I just coloured in over the top with some highlighting to show the different levels, different layers of skin or fascia, as we call it. So yeah, this is the sort of thing that I do. And so we're going to do the knee today. I've got my anatomy book set up in front of me. I'll put a reference to that in the description below. It's the Atlas of Human Anatomy by Frank H. Netter. Some people like to use different anatomy books, there's loads of them out there. This is my favourite. It's pretty much just pictures, there's no real description of the different parts of the body in it. The most famous one's probably Grey's Anatomy. You've probably all heard of it because of the TV show, and that's what it's referencing with that name. Not just Meredith Grey, the star of the show. But yeah, so we're going to do the knee. I need to find the knee in my book. I haven't got it set up because I'm not an organised person. So let me just set that up. I'm also going to have a cough drop during it. I know that some people like the sound of that. Reminds me a lot of ASMR Articular. I've definitely taken some inspiration from him there. So I'll put his channel in the description below. at the knee, so that's K. I'm actually awfully bad at remembering where things are in the alphabet. K, what is that? Is it after I? Before I? J, K, after. Knee. So that's on page 497. Page 497, page 5. There we go. And I'm just going to draw out the pictures. It'd be quite nice to have a camera of what I'm seeing. Perhaps I'll do it. Do that another time. I'm not very good at editing, so I'm not sure how to do that, but we'll get there eventually. Just picking a picture that we want while I get a cough drop. This bit here, this selection is the things that I need to go through. This is outlined by my university. So, the first thing we want to do is describe the bony anatomy of the knee joint. So, let's get onto that. Find an appropriate picture first. Here we go. Let's go with that. So it says, describe the bony anatomy of the knee joint, including the shape of the articular surfaces. The articular surfaces are the surfaces of the bones. Or is it articulate? Articular means movement with other bones, so the interaction of bone on bone, bone to a different bone. So for example, in the knee joint, I'll draw it out for you now. We have two articular surfaces. We have the large femur that comes down distally, the distal end of the femur. Distal means the most distant from the trunk of the body. So say the distal end of my leg, my lower limb, would be my feet. That's the most distal part of my leg. So the distal end of the femur. I'm not particularly good at drawing, so we'll just label that. That is the femur. Might be better actually if we draw it coming from this direction, I think. Yes. So your femur actually comes down at a bit of an angle. We think that our legs are completely straight, like this. And they are. But our femur actually comes down at a bit of an angle. Maybe not quite that much, but this being our knee. This being the top of our leg. And going into our pelvis here. And then the bottom part of our leg comes straight down, like that. Sorry, I'm going a bit of a tangent, but I think this is still quite interesting. And this angle, or this line, that comes through the middle of the knee, but doesn't come directly through the femur is what we call the anatomical axis. Sorry, that's not true. It's called the mechanical axis. Let's just zoom in on this. This is a mechanical axis. And then this axis, the top of our femur through to the centre of the knee, completely different angle as you can see. That's known as the anatomical axis. Of the femur. This is the mechanical axis of the leg. You've also got a similar pair of angles for the tibia bone, this large bone here in your leg, or the lower leg. It's the tibia. You have another smaller, much thinner, non-weight bearing bone, known as the fibula bone, there as well. But I've already covered that in my other drawings. Not ones that I've recorded. You can always go over them if anyone's particularly interested. I'm just going to take a quick drink of water. I really have no idea how much material we'll get through. Especially at this rate if I keep on rambling. So yes, back to the knee joint. Then inferior to the femur. Just outline that in a slightly thicker line. Inferior to the femur with the tibia. Let me just move that a bit there. Inferior meaning below, in reference to something. This structure would be superior in relation to this structure. Whereas the tibia would be inferior in relation to this structure. Okay. We don't really need to draw the bone out particularly accurately. As long as you get some of the bony structures in there, enough to be able to identify them. Now, we have one more bone within the knee joint. The knee joint is being specifically this area. This let's redo that. Is the knee joint. It's where the bones articulate against each other. Okay. The third bone involved in the second articular surface is your patella bone, or more commonly known as the kneecap. And this only articulates with the femur. If you touch your knee, you feel that bony prominence at the front of your knee, or the anterior aspect of your leg, which means in front of your leg, posterior being behind. So this is the I'll label this so we know the anatomical terminology. This is anterior. This is posterior. Sorry, I just knocked the microphone. This is inferior. Obviously this is always in relation to something else, but generally speaking these are the directions they are. This is superior. this way from this point is distal, and again this way to this way from something in relation to up there would be proximal. That is actually not true. Sorry, that's really badly explained. Something from here in relation to something down here is proximal. So this thing would be proximal to something down here, so further away from the trunk. And this would be, so something distal would be, this would be something here in this position that I'm circling, would be in a distal position to anything up there closer to the trunk. That's what we know as distal. I'll leave them there for a little while before we need the space. Now let's draw in let's quickly label each of those things we've just drawn. So this, we know is the tibia. As I said, there's another bone of the lower leg, known as the fibula, but this does not interact at all with the knee joint. It is in terms of articular surfaces anyway, it does interact with the knee joint in terms of the muscles that are related to it, as there are tendons that cross the knee joint. So a muscle will be up here and will turn into a tendon and then attach to a bone, so that when the muscle contracts, that pulls the muscle it is attached to in the direction that it should. We'll go on to that in more detail later, possibly in a different video. But there are attachments to the fibula, and that is all the fibula is used for, attachments to muscle. I might have a piece of chewing gum now, actually. Excuse me. So, I think we might keep this a little bit shorter today, seeing it's my first one of these. See what you guys think about it. So I'll just draw this image, label it. I think we'll leave it at that. There's a lot to go into, as I said, for one lecture that I have. We would go through each of these. Some of these are quite difficult to draw, such as identify bony features on an X-ray. That would just need labelling, so I probably wouldn't do that. But anyway, we'll just do the bony. As it says here, we'll just cover the bony anatomy and the shape of the articular surfaces. So, on that note, let's do the articular surfaces. I'll do it in blue because that's the colour, or vaguely the colour, at least the way that we draw it in anatomy, of hyaline cartilage. Hyaline cartilage lines most articular surfaces. There are different types of cartilage. Fibrous cartilage being one. The lightest blue we can get. Let's use the highlighter. Maybe better. Not that big. Nope, a bit smaller. We'll just, and it lines the surfaces like this. So you have one here, and where they kind of overlap like that, that gives you a good indication of the job they do. So there'll be another one here on this bone, the tibia, like that. The whole thing is within a big capsule that kind of surrounds the whole thing. Ooh, that's far too big. It surrounds the whole thing. And it goes from up here and about here. And the reason for this is to kind of lubricate and provide padding, so shock absorbers. Well, the cartilage, these are definitely shock absorbers. And given that all of our weight goes through our legs, our knees are under immense stress every time we walk. I think it was something like when we jump, we exert about 15 times. Don't quote me on this, I'm just recording it from a lecture. But we transmit about 15 times our body weight, obviously through our legs. That's the way the weight goes, the force goes. So the knee has to be able to bear that. That's why they have these thick hiding cartilages, so that the bones don't directly bash into each other, which would obviously be bad. Obviously, these cartilages can break down over time. Again, a different topic entirely, but simply put, that is vaguely the basis to arthritis, things like that. It's actually an autoimmune disease, so I won't go into it in too much detail. Again, don't quote me on that, but that is essentially where the pain comes from. Bone-on-bone contact through the destruction of these hyaline cartilages and sort of capsules. Capsules usually stay in contact, intact, should I say. The hyaline cartilage, not quite so much. Let's colour in these bones. I like to colour everything in, as you saw in my other images. It makes it a bit nicer when I come back to look at it, and it gives a bit of depth to everything. Ooh. Okay. Now, start to draw in a bit more detail. I'm just going to take the purple. We'll draw in some of the cavities. So we go in here. We have a large cavity that kind of runs through here. There's a small gap between these two. As I said, they don't really come into full contact constantly. There's fluid that surrounds the capsule. That's really for lubricating, and that comes all the way up here. And these cavities are usually formed. Get rid of these now. Are formed by other structures, rather than like a specific membrane, perhaps. So up here we have the muscles of the anterior compartment of the thigh. So the anterior being this side. I won't go into deal about what compartments are, but it just means a section or a selection of muscles that make up the anterior part of the leg, so the front part of your thigh, where those big powerful muscles are. So if you extend your knee outwards, what is that flexing? It is extending. And extension and flexion are again specific anatomical words. So I won't go into too much detail. But if you push your leg outwards, so you have a straight leg, you can feel the contraction of the muscles in your thigh. And this is what they're doing. This is at least where they are, and the actions that they take. So, kind of give a small amount of detail to these. Let's go with a really light, really kind of bright blue for this. muscle represent the tendons. What we have, again, let's colour them in. Is, I won't go into too much detail about the actual muscles. We will put some detail in it there. Is your, I'm colouring in the quadriceps at the moment. I'm more specifically called the quadriceps femoris, which isn't, from memory, one single muscle, as the name suggests. There are 4 parts to it, quadriceps. Now we have the biceps brachii. Brachii referring to arm, biceps meaning 2, and seps meaning head. So 2-headed muscle of the brachii, the arm, so the bicep brachii. There you go. There's your big one, so when you flex your arm, that's what you see, those big bulging muscles in your upper arm. Now in that sense, that is one single muscle with 2 heads to it, 2 bellies. Not necessarily, but 2 parts to the muscle, but it is technically one single muscle. However, the quadriceps femoris is 4 muscles. This is the quadriceps. Quadriceps femoris. But that is made up of 4, so the 4 heads to it. Just highlight that for you. Quad, obviously meaning 4. Seps, coming from cephalic, such as meaning your head in Latin. And femoris, coming as in related to the femur. Fem, femor, femur, femoris. Makes sense. And this is composed of, like I say, composed of 4 different muscles. The 3 vastus muscles, which is the vastus lateralis. I think it's lateralis with an I. Vastus intermedialis. I'm not so sure about it might be an I or a U, so I'm going to draw this. I'm going to write it with a little IU. Find out for yourselves, I can't remember. And the vastus medialis. Let's just quickly tell you about this as well. Another anatomical term. If you have your person like this, anything this side, so kind of far away from you, or slightly adjacent to the centre, we refer to as lateral, again always in relation to something else. Everything in the middle, as you can probably expect, we refer to as medial. So as you can expect, these vastus muscles, with the names like such as lateralis, intermedialis, and medialis, these are all referring to the position of these muscles in relation to each other. So if you have, again, this is not particularly accurate. If you have your femur, looks roughly like that. Let's get our muscles. So your knees here, your vastus or vasti muscles come down like this. And this being your pelvis, this being your other leg, your body's here. So then we can label these quite easily, knowing that these 3 muscles of the quadriceps femoris, are known as the vastus muscles, and we know that they are named in relation to each other spatially. This is going to be the medialis. Oh, yeah, I think it actually might be a U. This is the intermedialis, and this is the lateralis. Bloody hell, what am I doing? There you go. Everything here is medial, everything here is lateral. Moving on. And then the fourth muscle of the quadriceps, I cannot remember. It might be the sartorius. I don't think it is. I can't remember. You can go ahead and find that out for yourself. Now, this one, looking at the book, is the articularis genu muscle. And these all have their own tendons, of course. Now, this is me speculating, but I think I'm probably on the right lines. Obviously, articularis means it's involved in the articulation of something. All muscles are. But genu in Latin means knee. Or bend. Everything related to the knee is usually genu. That's why, if you're religious, you might be familiar with the phrase genuflect, which is when you kneel down or kind of bend over to pray. That's where it comes from, genu, the bending of the knee. Yep, that's there. So I expect that it'll attach somewhere in the knee joint. These all do, but that makes it particularly evident. We'll just colour in these. So yes, these muscles are all separate. All of the quadriceps femoris muscles, they're separate, but then they come together to form a single tendon, which, as you might be able to guess, is the quadriceps tendon, which attaches to the patella. This being the patella, your knee bone. I'll put that here. Kneecap, even. Okay. Now, the patella is known as a sesamoidal bone. And the reason for this, as you might be able to see, remember that everything in anatomy, the namings of it aren't random. Some of them are. Some of them are named after people, certain anatomical structures, but everything does try to be standardised nowadays. So it's called sesamoidal because, for one, it's shaped like a sesame seed. That kind of shape. Looks more like that. Kind of like a sesame seed. But sesamoidal also means it is completely encased within a tendon or ligament. Ligament is more appropriate. Tendons attach muscle to bone. Ligaments attach bone to bone. And that's what the patella does, inferiorly. Take a quick drink of water. So, this tendon moves like this. This is actually a complete continuation of the same tendon. Most tendons don't do this. That's why it's a special bone. Ligaments, this is special. It's known as sigmoidal because this technically completely encases it. As you can see, this doesn't happen on other bones like here. That doesn't happen very often. Only with sigmoidal. The patella is not sigmoidal, sesamoidal. And sesamoidal bones are all over the body. We've got lots of them. They're all usually very, very, very small. The patella is the largest one. Quite a big bone in terms of sesamoidal bones. Now this one, do get a change of name at this point. It's technically still the quadriceps tendon. We can't call it a tendon because it doesn't attach a muscle to a bone. Now it's bone to bone, so we call it the patella ligament, or more formally, I suppose, not really formally, but more traditionally, the ligamentum. Is it here? It doesn't say it in the book. It's ligamentum patella. Patellus. Again, you might want to look that up. I'm not sure that's completely accurate. Okay. So now, we'll draw some more specific features. Let's change to green. Talking about something other than break things up a little bit. These are the articular cartilages we talked about. That's the patella. Now this darker blue it's called a synovial membrane, and these encase most, I'm going to go with not all, joints for the role of lubrication, like I said. So within this synovial membrane, it's not good. Within this synovial membrane, so the synovial membrane continues around here. Might extend down here a little bit, but within it we have synovial fluid. We call that interstitial synovial fluid. Again, and that's what lubricates it. It lets bones slide across each other with ease. When you lose this, it's a bone sort of roughly pass by each other. That's where things get painful for people. And the damage itself in arthritis is usually caused by inflammation, sort of autoimmune inflammation. We'll probably cover that in another lecture. I think I did a lecture on that quite recently. I'll go over a couple more things in yellow with this kind of goldy colour. It's probably more accurate. We'll fill in between here. I don't know if it goes over, it doesn't need to be massively accurate. Within here. And this, with the similar function, these are large fat pads. This is why fat's good for you, really, in some senses. So here, this is called the let's make sure I write it out nicely. That's the infrapatella. Infra for inferior. Patella, so below the patella. Infra to the patella. Below the patella. Fat pad. And this one, which is sort of sandwiched in between the quadriceps femoris and the articular genu muscle, as you can probably guess. Supra for superior. Patella. Fat pad. And these are for similar reasons. Now, just had a look. This is our navial membrane. Actually get like this. What we'll do, we'll just try and cover the fact that I put it there. So, we'll go for that as well. Highlight it a bit more. Those are the fat pads. There you go, provide cushioning. And now, the last thing that I want to do, that I want to show you, we'll use this colour. I think it's called bursa, bursae even. No, bursas, bursae. Kind of membranous sacs that again contain fluid and are for protection, sort of mechanical protection. You have 3 of these around the knee joint. Maybe they could be a little clearer. Try a different colour. Let's use this pink colour to just kind of outline them again. One there, one there, one there. So, what do we call these? As we know, they are named in relation to their position. Let's use the pink. This one is in front of the patella, but is also within a layer of fascia, which we know is like a layer of skin, like a tissue layer, called the subcutaneous layer. And so we call this subcutaneous. Let's go a bit. Just get rid of this big arrow. Don't we need that, do we? Don't think so. The subcutaneous, because it is in the subcutaneous layer. Pre-patella. Presumably because it is in front of the patella, it's anterior to the patella, and bursa, because that's what it is, it's a bursa. This one, we'll leave over here. Again, subcutaneous, we see that it's in front of the this ligament. It's quite likely to be a what we call superficial. Superficial meaning close to the surface of the skin. Anything that isn't superficial is further in. We call deep. So deep is the opposite of superficial. So this is called the subcutaneous. Infrapatella. Below the patella. Bursa. And finally, we have the deep, as I just said, deep opposite to superficial, and this one's called subtendinous, or in brackets, this is behind, or posterior deep to the patella ligament. Infrapatella. Bursa. Now, so that is quite a lot so far. Covered quite a good amount. I think we can stop here. want to just quickly label one more thing on the tibia. This little protrusion, bony protrusion, which we call a tuberosity. These kind of little knobbly bits on our bones, we're called tuberosities, and they're usually there for muscle attachment, which is exactly what this is for. As you can see, the ligament, well, not necessarily just for muscle attachment, but just attachments of things to other things. So we call this the tibial because it's on the tibia. Tuberosity. You can see this the patella ligament attaches the patella to the tibia via the inferior surface of the patella here to the tibial tuberosity of the tibia. Okay, a couple more things that you could definitely put in. I think we could probably cover that in the next one. I think I will. So yeah, I think that'll be it for now. Thanks for watching. Hope you found it interesting. Please let me know if you like this kind of format, if there's ways you think that I could improve it, or perhaps just subjects that you want to hear about. Cool. Thank you.